Good afternoon, ladies and gentlemen, and welcome to the National Press Club, where the subject of today's National Press Club telecom address is Aboriginal health, a matter which has been very much in the news for very many years, but particularly in the last several months, resulting, as you might have remembered, in some changes to the administrative arrangements under which Commonwealth funding is supplied and services are directed through the ATSIC and the Department of Human Services and Health. To address that topic today, we have two outstanding advocates of the subject on behalf of Indigenous Australians, Barbara Flick, who is Aboriginal Health Policy Officer with the Australian Medical Association's headquarters here in Canberra, and Noel Pearson, who's been here before as Executive Director of the Cape York Land Council, although today he's concentrating on the health issue. They both have fairly brief opening statements to make to you before our period of questions, and the first one will be from Barbara Flick. Please welcome Barbara Flick.
Thank you. Thank you to the National Press Club and also to Telecom for making this opportunity available to us. Noel and I would like to acknowledge the Ngunnawal people, the traditional owners of this country, and I also acknowledge the elders of the Gomeroi Nation, my father's people, and the elders of the Yuwalli Nation, my mother's people. The right to the enjoyment of the highest attainable standard of physical and mental health is affirmed in Article 12 of the International Covenant on Economic, Social and Cultural Rights. In our relatively prosperous nation, the possibility of a high standard of basic health services being available to all citizens is achievable. So it is a cruel irony that the people whose dispossession underwrote the creation of the very wealth that allows universal good health to be an achievable goal of public policy are now the most unhealthy sector of the population. It is shameful that the health of Aboriginal and Torres Strait Islanders continues to deteriorate. Politicians of all persuasions recognise the imperative of tackling health problems. However, the differences that exist in approaches to the problem are not just ones of priority. They run much deeper to a basic comprehension of the concept of rights. We are not seeking the right to good health as a special right based on being Indigenous. We seek a right to which all Australians are entitled, a right of citizenship. We are not seeking pity or public charity. We are merely seeking that to which we are entitled, healthy lives and a healthy future. Australia has the dubious distinction of being the only Western country where the health of the Indigenous adult population is not improving. While infant mortality rates are 1/5 of the rates of the 70s, there has been no improvement in life expectancy. We can still expect to die 15 to 20 years earlier than the rest of the population. This contrasts poorly with a statistic for Native Americans, where the gap in life expectancy has been narrowed to about 3 years. I have been with the Australian Medical Association for only 9 months. And as someone involved in Indigenous health issues for nearly a quarter of a century, not to mention what I've lived all my life, I thought I knew the broad parameters of Indigenous health problems. However, the daily contact with the field I've had over this period has shown me that the extent of the problem is far greater than I had envisaged and that the international comparisons are accurate. The health of our people is getting worse, not better, and that the rate of this health decline is rapidly increasing among major groups of Indigenous Australians. In fact, our health statistics equate with countries such as Haiti, Ghana, India and Papua New Guinea. Our sons born today will have a 45% chance of living to the age of 65, and our daughters will have a 54% chance of living to that age. Over the last 40 years, the health of our babies and children has improved, but the health of adults has deteriorated. But we need to remember that declining death rates amongst our children is not to be seen as the only indication of evidence of improved health. There remain unacceptably high levels of disease and disability amongst our children, which are in many cases reflected in adult rather than child death rates. A recent study in a New South Wales community shows that only 1 in 10 Aboriginal adults survive past the age of 45 years. As a 44-year-old woman, if I lived there, my days would surely be numbered. One of the major debates in Australia these days is over the ageing of the population and what this might mean for social policy in the 21st century. For Indigenous Australians, if the figures keep heading in the direction they are, we just won't have much in the way of old people. Not too many of us can look forward to joining the grey power lobby group. These figures are just a snapshot of the situation today. I'm warning you that many of these figures will get worse unless we take urgent national action. We cannot hide from the fact that, per capita, less money is spent on Indigenous Australians' health than is spent on the health of non-Aboriginal Australians, particularly in the area of primary health care. To put it bluntly, the current method of funding and administration of Indigenous health care is discriminatory. The irony is that Indigenous Australians with an internationally acknowledged poor health record are subsidising the health care of non-Indigenous Australians. The story that the millions of dollars that has been put into health care has in some ways been wasted is a myth. There never has been enough resources in the first place. This was acknowledged in the recent evaluation of the National Aboriginal Health Strategy, which points out that the strategy, which was developed in 1989, was never effectively implemented, was grossly underfunded, especially in remote and rural areas, has suffered a lack of accountability at all levels of government, and lacked political support from state and national governments. The reality is that there hasn't been a national, cohesive commitment to the improvement of Indigenous health, and that resources have been woefully inadequate. The National Aboriginal Health Strategy evaluation points out that unless resources are dramatically increased, the year 2001 targets of the original strategy will not be realised. The tragedy is that we'll be able to count the lack of achievement through the early and untimely deaths of members of our families, our children, our brothers and sisters, and our mothers and fathers. The following are the minimum short-term requirements of a cohesive national plan. The Commonwealth Government should assert its constitutional responsibility for Aboriginal health, deriving from the 1967 referendum, and that therefore the funding of Aboriginal primary health care should be the responsibility of the Federal Department of Human Services and Health. Secondly, improving Aboriginal health status requires community development processes including infrastructure, education, employment, and improving the community economic base. And thirdly, more resources and attention need to be given to the provision of primary health care under Aboriginal community control. This has been recognised by the National Aboriginal Health Strategy and the Royal Commission into Aboriginal Deaths in Custody. I was encouraged recently by the comments made by the Federal Minister for Health, Dr. Carmen Lawrence, when she indicated her priorities are to ensure the expansion of existing primary health care services linked with infrastructure and education, that there be funding for training and recruitment of staff, that proper regional plans be put in place, and that the buck stops somewhere. The days ahead and the lead up to the budget is an important time for those of us who are looking to see if the federal government is going to make the commitment required. The challenges ahead of us are great, and there is no one person in this country that has any illusion that this is going to be an easy road to travel. The problem that we have today is that no government or bureaucracy is responsible to ensure our access to primary health care services. The buck doesn't stop anywhere. Is it any wonder that I ask how many human sacrifices are to be made before someone takes the reins of responsibility? Any fool facing the barrage of health problems that we're trying to address will tell you that long-term strategies and a commitment to long-term funding is vital. It is vital to improving the health status of any community in the world. The same fool would be able to tell you that a 3-month funding cycle is a joke, and a sick one at that. But it is this sort of sick joke that our people face every day of the week in trying to achieve healthcare and services that are commensurate with that enjoyed by non-Indigenous Australians. It is this sort of sick joke that will keep killing our people. The Prime Minister, Paul Keating, has been courageous in developing an approach to Indigenous issues in this country that has outstripped all his predecessors. He embarked on a campaign to address the relationship between Indigenous and non-Indigenous Australians and responded to the historic High Court Mabo decision in enacting the native title legislation. The legal myth of terra nullius has been dispelled forever. His government then committed itself to a land acquisition fund in recognition that all Indigenous Australians would not benefit from the native title legislation. And with bipartisan support, his government set up the Council for Aboriginal Reconciliation to explore a negotiated agreement on how we want to live together in this country in the years to come. He also set up a process to define a social justice package to address other aspects of our rights. The government is aware that it has a long way to go to ensure that these rights are delivered and that it will involve their continuing commitment. It will require a similar commitment from government to tackle the growing crisis in Indigenous healthcare. The government will need to achieve a major breakthrough in their approach to establishing a national, realisable vision for Indigenous health. I'm grateful that the Prime Minister has acknowledged this in calling recently for a new cooperative approach from state, federal and local governments to target Aboriginal health problems, starting with the worst affected Indigenous communities. Furthermore, on his visit to Hopevale recently in the Cape York Peninsula, Mr Keating recognised that the time for demarcation disputes over who would administer funds are over when he said, "What has to be done is to put the strategy together and not to be territorial about it." This echoes the words of Michael Dodson, Aboriginal and Torres Strait Islander Social Justice Commissioner, in his recent annual report when he said, "We need leadership and example right throughout the political system and in the rest of society. It is not good enough for state politicians to nudge and wink, as it were, about Indigenous peoples. They must show that the subject of race relations is everyone's business and everyone's work. They cannot simply leave it to the Prime Minister." Some people call me an alarmist or say that I am a doom and gloom merchant. Some even say I'm naive or that my hope in the present government is misdirected. But I honestly believe that if the federal government doesn't take control over the situation now, we may not get another opportunity. For many of our people, this may well be the last chance we have to get it right. It should no longer be regarded as normal that Aboriginal people are expected to be always sick, to die young, to die violently, or of diseases that have disappeared in the rest of society. It should no longer be regarded as normal for Aboriginal people to have living conditions that would raise eyebrows even in the third world. It should no longer be regarded as normal that Aboriginal people are expected to share ablution facilities. It should no longer be regarded as normal that we do not expect Aboriginal people to have running water inside their houses unless it is septic overflow. It should no longer be regarded as normal that we expect Aboriginal people to be patient while they live for years under plastic tarps while waiting somewhere on someone else's list for a decent roof over their heads. My message here today is not just directed at the government. It's directed to the government and to the opposition. It's directed to the people of Australia. It's a message about a crying and urgent need for all Australians to unite to avert the coming disaster. Not so long ago, it seemed all Australians, including the politicians, were united around the banner of getting the Olympic Games to Sydney. I admit I wasn't all that enthused because during that week we had a number of funerals to organise. Nevertheless, I don't think it's too much to hope for or expect that all Australians might rally about a cause that affects the future of Indigenous Australians. Part of this is a process whereby Australia will, at last, mature as a nation. Reaching solutions to the immediate and long-term health needs of our people will be a necessary part of a negotiated relationship between Aboriginal and Torres Strait Islanders and those Australians of goodwill who've reached these shores over the last 207 years. Thank you.
Thank you very much, Barbara Flick, and it's my pleasure now to introduce our second speaker today, the Executive Director of the Cape York Land Council, Noel Pearson.
Thank you. Only yesterday, I finally completed Paul Kelly's daunting tome, The End of Certainty, after sporadic attempts at getting through this illuminating account of a seminal period in our country's history, the 1980s. At times compelling in its insights and fascinating in its intrigues, and at times feeling under distinct threat of being chloroformed by arcane economic detail, I found Kelly's account of the history and politics of Australia from 1983 to the present indispensable to understanding the economic and social policy revolution which the Hawke-Keating Labor government led through this period. Kelly's broad analysis is of three phases of Australia's history following the coming of Europeans. Firstly, the foundation period from the time of European occupation to the late 19th century, then the long reign of what he calls the Australian settlement, from Federation to the end of Fraser, and then the deconstruction of the Australian settlement from the Hawke-Keating era to the present. The pillars of the Australian settlement, to which Kelly shows there was a basic bipartisan national commitment for over 80 years, were the pillars of white Australia, trade protection, wage arbitration, state paternalism, and imperial benevolence. These pillars eventually came to be understood to be unviable policy principles, which ill-served a country that was going to have any hope of being economically, culturally, and socially strong now that the farm and the quarry were no longer providing for the lifestyles to which the country had long become accustomed. The Labor government's policy revolution of the 1980s was fundamental to the deconstruction of that Australian settlement. The fundamental nature of the reforms, contemporaneously derided as that scourge economic rationalism, but now the accepted orthodoxy, can scarcely be comprehended for the scale of the challenge which the country's structural problems represented for Australians in 1983. So many of the accepted ways of life and business in Australia had to be disturbed, and reform and the courage for reform was imperative. But even as the country has striven to get the fundamental economic reforms into place, there's always been the question of what social and cultural policy would best serve a nation which is committed to a free market and committed to a future in Asia. Today I focus on one particular policy challenge which is key to achieving fundamental reform in the social life of the nation, the challenge of a lasting and just reconciliation between Indigenous and non-Indigenous Australians. And I wish to locate the position of Aboriginal people in the national scheme within the broader context of the economic and social policy reforms which the nation started prosecuting in the 1980s and which continues with renewed vigour in the 90s. There is no doubt in my mind that reconciliation is key to this country's achievement of a prosperous, confident, united and yet diverse national community in the new millennium. For black and white Australians to deal with the past, to acknowledge its truths and to understand its legacy and to never forget its lessons and to nevertheless engage for the future is a fundamental social accompaniment to successful economic policy. The struggle of Mabo and the long tradition of struggle of which he and his people were a part from before and including the Tent Embassy yielded to this nation an opportunity to finally put paid to the racism which has bedevilled the Aboriginal place in the national scheme, which had rendered the Indigenous people homo nullius, a people devoid of legal rights to their land and frequently to their very existence. Mabo has given us the opportunity to finally bury the legacy of the White Australia policy. The High Court has declared that the common law of our country will no longer suffer racial discrimination when it comes to determining entitlement to land. We now have national legislation which enshrines these legal rights and which aims to produce substantive justice to groups who can claim remnant rights. Furthermore, through the Indigenous Land Fund, there is now the prospect of recovering land where people are unable to establish rights at common law. For me, there are three developments which give me some optimism that we can reach the stage of confronting what we must not kid ourselves as being in large part a violent and ugly past, and to deal with its legacy in the present and still look to the future. These are the revolution in the country's historiography, which has come about because the story of the other side of the frontier has now been exposed by the oral histories of Aboriginal people and historians such as Professor Henry Reynolds. This new history, which tells of things which were long suppressed by what the late Professor Bill Stanner called in the 1960s a cult of forgetfulness, is critical for the country because it tells the truth and incorporates Aboriginal death, sacrifice and achievement in the national narrative. The second development was, of course, Mabo, which finally abandoned terra nullius as an assumed pillar of the country's legal foundation and the fundamental lessons from the High Court about the moral prescriptions of our history. The third development was Redfern Park in 1992, because here was the nation's leadership admitting the sins of the past, not wallowing in guilt, but instead expressing a preparedness to embed the legal and moral imperatives of Mabo into our national institutions and be the impetus for change for the better. These developments give hope and they provide direction. The task now is to make these symbolic and institutional achievements actually deliver social justice for people on the streets, under the tin humpies, and living under the bridges. Mabo, reconciliation, social justice, all of these things must actually have consequence for people on the ground. It must mean something for the quality and indeed the duration of their lives. And this is why the state of Aboriginal health is fundamental. It will mark success or failure. You don't need me to add to the countless reports on the subject to say that we begin way behind the 8 ball. The marginal position of the Indigenous peoples of Australia within the life of the nation is most starkly captured by one statistic: the average life expectancy of Aboriginal people compared with that of the rest of the nation. Aboriginal people of average die 20 years earlier than other Australians. I'm a self-confessed policy optimist. I'm in the talk up the possibilities business. I personally believe that community leadership is about knowing the problems, appreciating the difficulties, deconstructing the old approaches, condemning the inertia and the apathy. And community leadership is also about never giving up on the search for solutions and enjoining people to the belief that with commitment we can succeed. But when faced with such egregious statistics, one would be foolhardy to think that with optimism alone we can succeed. There are few places on earth outside of war zones where people have less chance of living to their fullest human potential. The statistics and the rate at which the situation has deteriorated since Aboriginal people have congregated into sedentary communities presents no small challenge to the country. The solutions will not be easy to locate, and they will not yield outcomes in all areas all at once. There are some problems which, if attacked with vigour and intelligence, can be eliminated quickly. Witness Fred Hollow's work with trachoma. But it is important for all of us to understand that improvement in the life expectancy of Indigenous peoples in this country is a multifaceted undertaking that goes beyond providing for primary health care to address diseases of the body. We will not see better statistics for another generation. Only when we have a society which can nurture their children from the cradle to the grave in the same way that other societies across the planet are able to do, will we see those children living into their 70s, 80s, 90s, and indeed their hundreds. It is important to not assume that somehow Aboriginal people are innately susceptible to short lives. The generation that lived and worked in the bush on the cattle properties and in agriculture lived well into their 80s and 90s. In my childhood and adolescence, my community was populated with large numbers of old people, including 2 grandmothers in their early 100s. These were people born in the bush, and they worked hard in the bush. Today, when you go to my community, there are fewer and fewer people beyond their 50s and 60s. In their traditional lifestyle, people lived long lives. Up my way, when they worked in the cattle, they lived long lives. The trouble started when we had to leave the land and congregated together, and so many lives lost purpose, and there was nothing to do. And in order to understand the deep problem with Aboriginal health, we cannot fail to acknowledge the spiritual malaise which infects the core of hundreds and thousands of Aboriginal communities and families. It is true that we have survived, but this survival has not been without cost, and there is much to repair and to heal. Policy prescriptions cannot fail to understand the wounding of Aboriginal identity and the sheer psychological toll which the settlement pillar of white Australia has had on a people for most of Australia's colonial history. The discomfort and terror of Aboriginal people so conditioned to racism and, at best, indifference from white society actually translates into these people being afraid to visit hospitals and doctors' surgeries. I remember as a young child watching the dignity of those dearest to me, strong, beautiful people in their own right, quivering whenever they dealt with white society and particularly officialdom. Until Aboriginal people feel proud and comfortable in their own country and comfortable in their dealings with other Australians, the spiritual malaise will represent the biggest reason for our failure to make progress on Aboriginal health. That is why the issues of land ownership, meaningful work opportunities, economic development, cultural renaissance and social justice are an inescapable part of the solution. Leadership from government and from the leadership of the Aboriginal community is key. Our people who daily suffer the problems cannot afford cynicism. Not from the media, not from the government, not from the opposition, and not from their own leadership. Action on improving Aboriginal health must begin now, and we will posture on the graves of our people as long as we dwell on the problems and fail to grapple with the solutions. There has been some commentary in recent weeks about whether the lack of bipartisanship from advocates such as myself about the direction of national policy is to be desired. Let me give you the reasons why I believe that within the context of the major social and cultural reforms which the country is engaged with in the 1990s, that the basic directions of Aboriginal policy which have emerged in recent years are correct. Firstly, it is because the new direction is based on right and not charity. Secondly, there has to be an emphasis on pragmatic results as well as a focus on our ideals. Our decisions on health have to be action-oriented. Thirdly, we have to deal with the moral turbulence which our colonial past brings to bear on the present. There can no longer be denial. Fourthly, there is no place for victims. Aboriginal people desire justice, equality, and there is a need to find strength through empowerment. The tragic and pervasive concept of the victim, which many Indigenous leaders have and still do mistakenly perpetuate, is ultimately a paternalistic and disempowering one. I say that we have the intelligence, resourcefulness, and grace to find the strength to succeed. Finally, there is no place for bleeding hearts, only for open and honest ones. Bleeding hearts always see victims. Confronted by Aboriginal poverty and disease, they inevitably ask, what can we do to help them? Rather than again smoothing the dying pillow, I say that the question to ask is, what can we do to make the conditions such that Aboriginal people can help themselves and need no longer be perpetual victims? Governments and a committed Australian community can indeed make the changes and take the effort to produce the conditions whereby Aboriginal people can look after and nurture their own. The changes centre on resources, economic development, land, and so on. Let me say that this club has an important responsibility to engage in this problem, not just to illuminate the problems, but to grapple with the solutions, to locate the state of Aboriginal health within the broader picture of the kind of society we want in the antipodes in the future. It behoves those of us whose job is to analyse the problems and challenges which face Australia to be cynical about prospects for improvement and indeed success. Critique must be followed by reconstruction, and we have to realise that this challenge is one for the long term. In conclusion, my belief is that the new directions of Aboriginal policy which have emerged in the 90s are the correct ones. I believe that the Australian community wants to see success and is prepared to give this, as in all things, a fair go. We need to be mindful of history when we resort to the cheap observation that Aboriginal policy is just too hard and is receiving inordinate public attention, the too much Mabo of recent parlance. When the National Land Rights Model was abandoned, the popular interpretation of this backdown put forward by the then Prime Minister Hawke was that public sentiment was not in favour of reform. Many commentators have since questioned this white backlash theory, popularised and blindly accepted at the time. What the polls did show then, and increasingly show today, is that there is a groundswell across the nation in support of progress. The reason that I even give a damn is my belief that ultimately empathy and humanity will shine through if there is determination and courage in our community leadership. The difference between Hawke and National Land Rights and Keating and Native Title is that there is now a preparedness to educate and to defend and to lead, and not simply follow and compound fears and ignorance. It's my view that decency in Aboriginal policy has now become in Australian political discourse a marker of credibility and a commitment to social cohesion, because there's no other choice other than cohesion. The futures of black and white Australians are inescapably enmeshed, no matter what fantasies some of us might harbour. This is not to say assimilation, but something more intelligent and necessary: unity through diversity. Black and white Australians cannot afford cynicism because our future will be a shared one. The challenge for the conservative side of politics, anxious for bipartisanship, is to understand that racism has been the most virulent disease contributing to the malaise within Indigenous Australia. The settlement pillar of white Australia cannot now be exhumed from its new grave. Justice, rights and responsibility must be the future national policy direction, not least in the area of Aboriginal health. The challenge for the Conservatives is not to undo the achievements and to abandon the direction. Thank you.
Thank you very much, Noel Pearson. Both our guests will be available for this coming period of questions from our media members, and the first of those questions today is from Alan Thornhill. I'd like to suggest to each questioner that they indicate whether they are directing it specifically to one or other of speakers or to both. Thank you, Alan.
To both. Alan Thornhill of the Associated Press. Having just finished Eric Wilmot's book, Pemulwuy, I've some idea now of how much Aboriginal people suffered at the hands of the New South Wales Rum Corps and their successors. The dispossession was complete. How 200 years later can we go about repairing that damage, providing the essentials of good health, a shower, clean bed, good food, and above all, a stable family, without which no one, black or white, can hope to preserve health? Thank you.
Well, I think the point that I tried to make in my talk was that we should be talking about citizenship rights here. We should expect the same as non-Indigenous Australians, but on top of that expectation is a recognition of the history of this country, the violent history, where it wasn't unusual to use guns, and that the land that Pemulwuy was involved with was in fact cleared of the people to run sheep. So there's been a history and a series of government policies over the years which has progressively disempowered us, and we need to stop harping on that and dwelling on the past and get on with the business of providing services that all Australians should expect in this country of ours today. It's quite a wealthy, developed country. There's nothing unusual about Aboriginal people wanting to live in decent homes, wanting access to employment, wanting access to education and other services. So I think we should stop treating us like a separate group of people, but get on with the business of providing those services and opportunities.
No?
I think that through the efforts on the social justice package that we have to look at the situation of those who have been most dispossessed through colonial history and realise that it's not just a matter of bringing people up to a position of equality, but recognising that these people also need justice. There has got to be a reparation made with these people in relation to basic rights to land and so on. So I would see that the delivery of basic services is essential, but you can't put aside the question of rights.
The next question is from Amanda Mead.
Amanda Mead from The Australian. I'd also like you both to answer this question. It's about the bottom line, which is money in the next budget. The ATSIC board is understandably concerned that the shift of primary health over to the Department of Health will not involve a significant increase in funds for primary health and environmental health. The Prime Minister and Dr Lawrence have both indicated that there's no room in the tight budget for a very big package. Do you think it will be a meaningful move if there is not a significant amount of extra money?
The fact of the matter that we mustn't forget is that ATSIC was only ever given top-up funding in the first place, that the Commonwealth and that the states and territory government had relinquished their responsibilities. And the fact of the matter is also that there's a $16 billion budget in the Department of Human Services and Health, and there's an opportunity for money to be shifted around and different priorities set, as Dr Lawrence has indicated in the last few weeks when she's looked at the Better Practice program and found some savings in there. So I think that structurally I would support a move so that we're in an area where there is a larger budget with more opportunity. I wouldn't expect there to be an announcement in the budget for billions of dollars to be put into Aboriginal health, but I think that as a start-off point we'd have more opportunity to access more funds through that department.
I think the question of the move from ATSIC to the Department of Health is one of finally giving Aboriginal medical organisations and Aboriginal communities access to the $34 billion spent on the health of all Australians. For the first time, our medical services will have to bring to account the expenditure of the Federal Health Department on Aboriginal health. And I think that's one of the advantages of a shift over to the Department of Health. From now on, ATSIC cannot be blamed for having insufficient resources to address a massive problem. In the future, I would expect the buck stops with the Minister for Health and Federal Cabinet to make sure that Indigenous Australians are getting their fair share. They're getting their fair share of the $34 billion which is spent on health nationally.
Lisa McLean.
Lisa McLean from the Australian newspaper. My question's for the both of you as well. What opportunities do you see in the upcoming social justice package to address health? And should there be sort of tough regulations on states to enforce some of those social justice recommendations?
I think the biggest obstacle to getting progress on Aboriginal health is that most of the resources are being channeled through the states, and the behaviour of the states in history has not contributed to a solution to Aboriginal living conditions. I think that the new direction must carefully assess whether the states are finally willing to get into a cooperative venture with the Commonwealth along the lines of that were reached yesterday in relation to competition policy. If there was just a smidgen of cooperation between the states and the Commonwealth on Aboriginal health, we would see vast improvement. We've never had that goodwill, we've never had that cooperation, and there's just been stonewalling and intransigence. So I see that tackling the states has got to be a major part of the Commonwealth's health agenda upon assuming responsibility.
The only thing that I'd add there is that in any new decisions that are made by the federal government, that there should be a process of penalty, so that states or the Northern Territory would be penalised if they didn't account for the funds in the way in which they're supposed to be used. There also needs to be a review of the Grants Commission processes, and there needs to be some firm rules set in place for not only the state and territory governments but local government as well, to be accountable in a more transparent way.
The next question is from Melissa Langham.
Melissa Langham from Australian Associated Press. One of the things that's mentioned in the social justice package is the protection of Aboriginal information about medicinal plants and how best to protect that. It seems to be one of the resources that remote communities do have in their hands in terms of possibly making money down the track. How do you think traditional knowledge of medicinal plants should be protected? Should there be a register or some other way of doing it? And should communities be able to use that money to improve health in their own communities?
I was going to make some comment about the Bush Tucker man and how he got a lot of bucks out of it. The responsibility of deciding whether or not people want to share their intellectual property rights over Bush Tucker or Bush medicine is, in my view, a matter for the people who own that information. And through the social justice negotiations, I'm sure that people will express a view one way or the other. But I do know that in recent years, the Menzies School of Health Research in Darwin, for one, did a bit of a survey of the communities in the top end to talk to them about whether or not they wanted those rights protected, and I don't know the outcome of those of that research.
Do you want to talk about that now? Matthew Frost is the next question.
Matthew Frost from SBS TV News. Question to both of you, or either of you. The local newspaper here in Canberra this morning, in its never-ending quest to cover local issues, has come up with an interesting one this morning. They say that there's concern in one of the dress circle suburbs that a drop-in centre for Aboriginal youth and adolescents is going to lower property values. Just in the context of the subject you've been discussing, really isn't the biggest hurdle that you have to overcome the attitude of average Australians, of the wider community, if you like, for doing anything for Aboriginal people that is seen to be offering them something over and above what the rest of the community is getting?
It's not just the challenge I have, it's a challenge we have. And I see that the education of the Australian community has got to face the fact that there are special measures required to bring Aboriginal people up to a position of equity. We're talking about a people who are living 20 years less life than anybody else across the continent. Now, if that doesn't bring to the front of our skulls the proposition that some special measures need to be introduced to get the improvements and advancement in place, well, then I'm not sure what kind of statistic will get us around to that position. I think there is an acceptance right across the Australian community that the Aboriginal condition is particularly deplorable. And the thing about the small percentage of the Aboriginal population is that a solution to this problem is within our grasp and within our means. We can never forget that a solution to these problems is within our means. We're a prosperous nation. We're a nation that is committed to a fair go. And I think the stumbling block has been the ideas and the bringing these issues to the front of the public mind, and I think pragmatically crashing through with the solutions. there's not enough hard-headed thought been given to how it is that we can get action happening in Aboriginal health. And my hope is that the new direction will be a cooperative one between strong, committed national government and strong, committed Aboriginal leadership on the ground. It's that kind of formula that I think is going to achieve the changes that are needed.
Barbara? No? And our final question is from Fran Kelly.
Fran Kelly, ABC Radio, and again ask both of you. There's been quite a bit of praise for the current policy leadership from the Keating government, from both of you today. Overall, and in particular in relationship to Aboriginal health, do you fear a change of federal government, given one of the pillars of conservative political beliefs is states' rights? And both of you have called on the Commonwealth to seize and lead the agenda here, somewhat removing it from the states who haven't, in your opinion, been up to scratch in fulfilling their responsibilities.
I'll just comment very briefly on that. If we are to mature as a nation, and we both talked about that, then what we need to see is a bipartisan approach to the health of Indigenous people in this country. Now, I would not like to be in the position to charge the coalition, if there is a change of government, for being immature if they drop the agenda that's already been set by this present federal government.
In relation to the states, I, like the Democrats, have harboured this fantasy that the states might disappear, but I think, but I think there has to be an acceptance that they're part of the problem with which we have to deal. And I'm optimistic that in Queensland, for instance, that with a strong Aboriginal medical service leadership and assistance from the Commonwealth Government, that we can actually get some good out of the State Department of Health. That's where the expertise is, that's where a lot of the dollars are, and I think that adopting a pragmatic approach to getting some of these solutions in place require us to engage with recalcitrant state governments and bring them to account. And I think that the Commonwealth has an important role, as I say, an important role to play in terms of the conditions that they attach to funding to the states, to bring them to account.
I suppose the point I was making was, given the coalition, the federal coalition's policy or belief, fundamental belief in states' rights, are you confident that if there was a coalition Commonwealth government, that they would force the states to deliver as they're supposed to deliver, that they would actually, heavy the states?
Well, that obviously, I mean, it's not very hard to glean that I share some grave reservations about how the opposition might tackle some of these questions when in government. I have grave reservations about how they would treat this fundamental question of Mabo, and so I think that I think it's an illustration of the problem of state rights when you realise that state rights has been traditionally the umbrella under which a policy of failure to help the Aboriginal community has been justified. That's the umbrella that has justified inaction on Aboriginal improvement. But the states surely don't have a right to deny these basic human rights to Indigenous people.
Thank you both very much. I said at the beginning that each of our guests today was an outstanding advocate of the Indigenous Australian people's cause in this area. Very different styles and with very different specialities, but as you've seen today, they mesh very well when it comes to the point. Thank you very much for joining us today, and thank you for our audience and questioners. Did you say you were going away today?
I'm going tonight.
Tonight? Are you going to be in the office this afternoon?